And welcome back. Well, it's common for couples to argue about sex or to struggle from time to time with intimacy, but what happens when your partner has cancer or chronic pain or an illness?
Statistics show that couples are more likely to split up when one person is sick. So today, advice to avoid problems with intimacy. Dr. Francie Stone is a clinical psychologist. She's also a certified sex therapist, an assistant professor at the Medical College of Wisconsin, and a member of several national organizations, including the American Association of Sexuality Educators. So she's qualified.
Yeah.
Great
You know what you're doing.
Yeah, exactly. Great to see you again.
Yes, great to see you guys.
It's true, isn't it, that a lot of couples, whether someone's ill or not, a lot of people argue about sex or have issues with their intimacy.
Yes, always arguing. That's our number one thing of quality of life in our couplehood, in our relationships is sexual activity and how much sex are we having or not having. So it is something that's quite up there to argue about.
Yeah.
And when we have medical illness or ill, that compounds it.
It makes me sad to think that when someone is sick or ill or struggling with something, that's when it's the most difficult, or that's when it could cause an end to the relationship. So the whole point today is to talk about these things openly and comfortably because a lot of people are dealing with them. Medical complaints that you hear a lot are medications, high blood pressure, diabetes, cancer, chronic pain, and mental health. So we want to kind of talk about some of these, especially we'll start maybe with heart disease and talk about some of the sexual issues that can be related to heart disease for people.
The most important thing with sexual activity and heart disease is one of the things that's kind of like a little myth out there, the widowmaker. The widowmaker started out as a type of heart attack and kind of morphed into anything that is discussed about heart attacks or heart disease or heart problems. And so oftentimes you'll hear women say, you know, we're not having sex because I don't want to kill my husband.
Because they're afraid it'll cause a heart attack.
Exactly. They're afraid it will cause a heart attack. So really the most important thing to do is to talk to your doctor. If your doctor gives you kind of a basic guide would be if your doctor says you're healthy enough to climb a flight of stairs, you're healthy enough then to engage in sexual activity. I do say talk to your doctor because everybody is individual and we want to communicate that information and make sure we got the right information for us.
Yeah.
Well, and let's say it happens, and I'm sure this is true for people, if one of the partners has had a heart attack, has some form of heart disease, can you still have sex following a heart attack?
Yes, yes. Again, once you've had that time to heal and your doctor has given you the go to you are okay to climb a flight of stairs, then you're able to engage in sexual activity. The thing is that we have to remember we're not running marathons when we're having sex. You know, we're not having sex for. You know, it's a shorter period of time. It is a shorter period of time. So yes, but you do want to clear that with your doctor.
And
You do
the
want to
same
make
is
sure.
true related to this blood pressure as well as heart disease. So let's talk about cancer because this. I mean, we all know so many people with cancer, and it's more common than we'd like to believe. How does cancer affect someone's sex drive?
Yeah, cancer, it can be any type of cancer is going to affect us and our physiological, our psychological, our overall interpersonal lives, intra and interpersonal.
How we feel about ourselves.
Right,
and our
how we
bodies.
feel about us and how we feel and look and our mental health, are we up or down, sad? So all cancers. The ones that I kind of focused on today were more in the pelvic region. Those for men would be prostate cancer. We know that prostate cancer closely linked with erectile dysfunction. When there's surgery to remove the prostate, there is a bundle of nerves that surrounds the prostate. And the surgeons, the doctors will try to do nerve sparing procedures with that. Not all the time is that always able to do, and there's so many that they have a difficult time, even the best, that sometimes there's nerve damage. And with that has to have a healing process too. Nerve damage takes longer to heal than like if you were to sprain an ankle or something. It takes sometimes years. So that's connected with erectile dysfunction. Also, enlarging the prostate can close off for ejaculatory control. Women, we are much more complex in the area of the pelvic region. So anything from hysterectomies to endometriosis to, I mean, the list goes on in terms of cancer, and that
And breast
those are
cancer,
not cancers, but
too, I think affects a woman's
also,
sex
absolutely.
life. And breast cancer is so common.
Absolutely. And affects women's feeling about themselves being a woman, especially if they have to have mastectomy or double mastectomy. What we want to look at is again, asking questions. You'll go in, you'll get a diagnosis, and you are flooded with information. And so bringing along your significant other or spouse or family member that you trust to talk, to be able to ask those questions, because you'll have many and then you'll forget. You want to ask before, during, and after what's going to happen as well.
Quickly on that topic, because sometimes you may get the go-ahead medically, but personally you don't want to, and you may be upset with your partner for them wanting to when you don't feel like it.
Yes.
Is it okay in a marriage to take that long of a break and say, hey, I don't want to have sex, and still maintain your marriage in a different way?
Absolutely. Absolutely. It is not always about sexual intercourse. It is about our sexual intimacy. It is about the touching. I always get to touch Molly here.
I know. So I like my seat.
But it's about the touching and the connectedness and the bonding, because when we're touching, we're releasing that oxytocin and we are bonding together. So if we have to take a break with sexual intercourse, we don't have to take a break with other things. Kissing and holding and snuggling and all of that, which is our sexual intimacy.
And I think your list of questions is good. For cancer, it's like how this might affect my sex life. When will it be okay to have sex? Are there types of sex I should avoid? What safety measures maybe should I take?
Right.
Diabetes is another one that affects people's sex life, as well as pain and chronic pain. I want to just touch on that because there are a lot of sexual issues related to pain. What are some specific things you should do if that's an issue in your sexual life and intimacy?
Absolutely. Pain is so common that what we want to do, the first thing we want to make sure we do, we don't look like we're hurt when we are in pain. So we need to communicate that to our partner. We need to say, okay, what position, maybe the position that we like hurts me right now, so we got to change positions. Don't forget to use pillows and support and cushions. We don't have to go out and buy. They certainly have those things available, but you can use your couch pillows and your bedroom pillows and that. Pain is an interesting one because we tend not to tell anyone, and then the other person gets their feelings hurt and feels rejected. So we really want to make sure that we're communicating that this is what's happening to me, and we also want to schedule things. If we have pain less in the morning or less in the evening, then that's when we want to try and be scheduling our sexual activity.
It feels like it's not spontaneous, but at that point, then you're engaging, you're having open communication, and that's the main theme here, is to talk, to have communication.
Absolutely, and we also said last time when we talked about spicing things up, well, we can plan a date and plan, and we can spice things up and send some nice little texts or little things to each other as we plan for our morning or our evening, whatever it is.
So plan it, but then add the spontaneity.
Right.
People can check out more information about you by going to drfranciestone.com. Medications also can affect our sex life as well as our mental health. So just be sure to communicate with your partner. Thank you so much.
Thanks for being here.
Appreciate it.
Thank you.